the Mindfulness for All program came about at the beginning of the lockdown in March 2020. I was sitting at home. I had sort of been banned from working in the trust, and I knew that my colleagues, particularly in the acute trusts, were working at the front line with very, very ill patients, also uncertainty about what's going to happen to their own well-being, uncertainty about what's going to happen if their colleagues go off sick. And I was sitting at home really wondering, what can I do to contribute to helping that process? What could we all do that was sitting in psychotherapy and in psychiatry and in other parts of the trust to help this process and support our colleagues? And this is when I, approached my colleagues and really asked the question, could we set up a daily meditation practice? And I had a wonderful response from practitioners all across the trust. And we came together very quickly and developed a daily rota of developing and delivering mindfulness practices to our colleagues. And we wanted to obviously make the mindfulness practices very relevant to people's daily experience with regards to all the emotions that may arise when you're at the front line, all the uncertainties and the fears that might arise when you're actually dealing with a pandemic in the front line. So we developed a bit of a routine around a themed week. So we developed ideas around how every week could have certain topics around mindfulness. And we started sharing out who's guiding the mindfulness practices. So you will see that we've also got different lengths of mindfulness practice in the Mindfulness for All, different techniques of doing mindfulness practice, but also really having some reflections around how can make it work on a day-to-day basis. Mindfulness practice has got a lot of benefits, and we know that from a lot of different types of programs that we've been offering over some years. We know from our work with junior doctors that mindfulness can work for health professionals quite well, and there's quite a lot of literature showing that mindfulness can help to improve resilience and to ultimately help people with their emotional regulation. And our program that we've done has sort of shown in the small studies that we did that we can get the benefit for them. We also know that mindfulness works for clinical populations, and we've been running mindfulness for relapse prevention of depression over many years. So we've got a lot of evidence from lots of different areas of delivery of mindfulness that mindfulness can have a huge benefit on just perhaps developing a friendlier relationship with our emotions, and perhaps also helping us what we call in regulating and soothing our emotions, particularly when times are difficult.
So I came to mindfulness probably about 8 or 9 years ago, and I think my motivation at that time was very much to do with learning perhaps how to deal with stress and change a bit more skillfully. And one of the things on a personal level I've really come to find a huge benefit is the ability to quiet the mind. Professionally, I think it's allowed me to build a lot of resilience to the demands of a clinical role. And also in the clinical setting, it's I've brought a lot of the mindful techniques that I've learned to my patient population. So I work as a dermatologist, which largely deals with a burden of chronic disease and a lot of diseases that affect self-image at that. And I've found many of the techniques that I've gained through mindfulness have huge applicability in helping patients to deal with the burden of chronic disease. So I would say that it's there's lots of different areas of my life that it has touched and brought many benefits to.
Mindfulness for me is, as John Kabat-Zinn, who introduced some of these ideas into the Western world, said, it's a way of being. And we do this through both formal practices where we sit and allow ourselves to be present for the breath and for our experience as it comes up, but also informal practices that we can use throughout the day. And I find both of these invaluable. And we've tried to put these together in the Mindfulness for All sessions that we have constructed. So there's both an opportunity to watch the recording and to practice a settling meditation in which we focus down and sometimes achieve a state of calm, sometimes not, because it's really very much about being present for whatever is here. And then the other component, which I find particularly helpful through the day, and hopefully people making use of these recordings will find helpful, is a more informal practice where we can just settle in to noticing what's going on, asking ourselves the question, what's happening for me right now? Am I agitated, activated? Am I actually present, or is my mind off somewhere else?
For me, mindfulness, and in particular kindness and compassion, and this sense of connection with all of humanity, but this recognition really that we are no different from our patients, is very important within the practice of mindfulness. This idea of being present with our own suffering, as well as with the suffering of others. I think that's something that's very important. And I think mindfulness, as other people have said in different words, this idea of feeling your feet and finding your ground when things are very difficult.
I love the platform because it really invites everybody to tap into these programs. It invites everybody to have an opportunity to learn about the versatility of mindfulness and the different aspects of mindfulness. So yes, I think it's an important resource. It's a massive resource. We've really recorded literally hundreds of hours of practice and discussions around it. So I think it's wonderful that has been set up.
So although the launch pad, if you like, for the development of these materials was the pandemic, and I guess initially the impact that was having on healthcare providers, I think one of the beauties of this resource is its universality and its relevance to a very wide range of groups. And while certainly I think healthcare workers will find a lot of relevance to them within this resource, I would like to think that we've created something that's really very widely accessible.
Yeah, so I think the accessibility and applicability is great. And I would say that mindfulness is never about persuading people. It's more about an invitation to explore and experiment. And I think that this platform lends itself very well to that. I think it's great if you can keep mindfulness quite light-hearted, if you hold it lightly. And I think it lends itself to small groups of people perhaps practicing together.
So we're very excited about this opportunity to share Mindfulness for All even more widely. So if you're interested, go to the King's Health Partners website and click on the Learning Hub. What's great about the Learning Hub is that people can access these recordings as and when they want them. They can find them a recent recording to sort of check in with, often things that might be discussed that are ongoing stresses around our life at the moment, but they can also access a whole range of past recordings that are arranged in terms of themes. So they can look at topics on some basic mindfulness, or they can look at topics about compassion, or about how you manage health anxiety in the COVID crisis. So a whole range of possible recordings to get hold of, listen to when you want to.